name is Omale Maureen Simon. I'm a 100 level nursing student of JPTS, Institute of Management Science and Technology, with affiliate universities such as South American University, USA, Global Wealth University, Togo, and Pan American University, California. I am here to make a presentation on the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. First of all, what is hepatitis B? Hepatitis B is a serious liver infection caused by the hepatitis B virus that's easily preventable by a vaccine. It can be spread by sexual contact and treatable by a medical professional. This disease is mostly commonly spread by exposure to infected bodily fluid. The symptoms vary and they include yellowing of the eyes, abdominal pain, and dark urine. Some people, particularly children, do not experience any symptoms. In chronic cases, we have liver failure, cancer, or scarring can also occur. Speaking of hepatitis B, we're also talking about virus. A virus is a small infectious agent that have a simple acellular organization with a nucleic acid and protein codes. A virus invades the living cell and uses its chemical machinery to keep itself alive and replicate in the host. Viruses cause many human infections and are also responsible for a number of rare diseases. The human diseases they cause may affect different organs or parts of the body. An inflammation of the liver is often referred to by the general term called hepatitis, which is often caused by a variety of viruses, which include hepatitis A, B, C, D, and E. Secondly, let's talk about antigen. In immunology, an antigen is a molecule or molecular structure that can bind to a specific antibody or T-cell receptor. The presence of antigens in the body may trigger an immune response. This antigen is a protein from the hepatitis B virus. It's actively replicating. The presence of hepatitis B envelope antigen suggests that the person is infectious and is able to spread the virus to other people. Thirdly, let's talk about antibody. An antibody is a protein produced by the body's immune system, which, when it detects harmful substance called antigen. Examples of antigens include microorganisms such as bacteria, fungi, parasites, and viruses. In this case, we're talking about viruses. Antibodies are also called immunoglobulin, a protective protein produced by the immune system. Antibodies recognizes and leach onto the antigen in order to remove them from the body. The hepatitis B virus belongs to the family Hepatnaviridae, which consists of the hepatotrophic DNA viruses. Hepatnaviruses shows narrow host ranges, growing only in species close to the natural host, like gibbons, African green monkeys, rhizome monkeys, and woolly monkeys. The hepatitis virus belongs to the genus Hepatnavirus. It is a 42 nanometer partially double-stranded DNA virus composed of a 27 nanometer nucleic acid core, a DNA polymerase reverse transcriptase surrounded by an outer lipoprotein coat called envelope containing the surface antigen that plays a major role in the diagnosis of hepatitis B virus infection. The genome consists of a partial double-stranded circular DNA molecule of about 3,200 base pair in length, with known sequence as well as genetic organization. Virion particles are identical to the virion tail. They vary in length and have a mean diameter of about 22 nanometer. They sometimes display regular non-helical transverse striations. The pregnumeric RNA, which is a strategy central to the life cycle of RNA retroviruses. Similarities and differences between retroviral and hepatnavirus replication have been defined based on the unique replication cycle of hepatitis B virus. Antiviral, the therapeutic strategies aimed at the reverse transcription of hepatitis B virus RNA or the hepatitis B reverse transcriptase to have been successfully used as antiviral to treat hepatitis B virus infection. The prevalence of the hepatitis B infection varies in different countries or regions in the world, as well as in different ethnic groups. Hepatitis B virus endemicity has been classified into three categories: high 78%, intermediate 2 to 8%, and low with less than 2%. In conclusion, a positive hepatitis B antibody test result means you are immune and protected against the hepatitis B virus. You cannot be infected and you cannot also infect other people.